Hi guys, so today we're going to talk about signs and symptoms of pregnancy. I get a lot of emails or texts from friends or you guys asking me how you know if you're pregnant. Well, the easiest thing is just go get a pregnancy test. But I know a lot of times that's not easy to do, or you're not ready to go check a test yet. First of all, if you are sexually active and if you're not using birth control, well, of course, you're at risk of getting pregnant. Or if you don't use your birth control consistently, sometimes if you forget to take a pill, or maybe you're using condoms but you don't use condoms all the time, or the condom broke, or there was a tear, or something happened. Basically, if you had sex without any protection, then of course you're at risk of being pregnant. So something else to mention is that you can still get pregnant even if you haven't had complete penetration, just from foreplay. And it's not very common, but sometimes sperm can reach your egg even if there wasn't penile penetration in the vagina. You cannot get pregnant from oral sex and anal sex as well, but sometimes when the sperm is very close to the vagina, it's very rare, but sometimes it can happen. Even if you didn't have vaginal penetration, if there is sperm near your vagina, it is possible to get pregnant. So if you had intercourse around time of ovulation is when you would be at risk of getting pregnant. The problem is a lot of women don't know when they're ovulating, or some women don't have regular periods, so then it's hard to know when you might be ovulating, so you basically don't know if you're at risk. Even if you have intercourse when you are having vaginal bleeding, sometimes vaginal bleeding isn't necessarily your period, it's just vaginal bleeding at the middle of your cycle, so sometimes that doesn't protect you against pregnancy. The only way to protect yourself against pregnancy is if you're using birth control and you're using it the right way, or if you're using condoms and you're using them every single time. The first most common sign is a missed period. So if your period is, you didn't get your period when you expected it, or if it's late, or if it's just spotting instead of your regular period, those are signs that you might be pregnant. Some women, when they get pregnant, they have spotting when the baby's implanting. So even if you had spotting instead of your period, that could be a sign of pregnancy. Another very common sign is nausea, especially in the morning, but some women have nausea throughout the day. You sometimes will vomit, sometimes you don't vomit. Just having nausea is a sign of pregnancy. It's breast tenderness or breast pain, or the breasts get swollen, having urinary frequency. Sometimes this urinary frequency can be with pain, but not necessarily. So you can just have urinary frequency without pain. And just feeling tired or fatigued all the time. So these are the most common signs. Other signs of pregnancy that maybe are not as common are cramping, pelvic discomfort, abdominal bloating, constipation, heartburn, nasal congestion, shortness of breath. Some women crave some food. Some women are disgusted by certain foods or odors, feeling moody or irritable, or maybe a little sensitive, feeling lightheaded. Sometimes the skin in your body can darken, like your areola, or a line in the middle of your abdomen that goes up and down in the midline. Your face can get, we call them melasma, it's like spots on your face. And if you're far along in your pregnancy, sometimes your first sign of pregnancy is that you feel something moving. You feel the baby moving inside. We hope that you know you're pregnant a lot earlier than that, but I've had a lot of patients who don't know they're pregnant, and they come in full term and they're like, oh yeah, I felt something moving, but I thought it was just gas. So if you feel something inside and all of a sudden you feel like your belly has grown, it might be that you're pregnant. Some women are very sensitive and perceptive to their bodies, so some of them will have symptoms as early as 5 weeks, but most of the time it doesn't happen until you're like 8 weeks. Throughout the pregnancy, very, very common complaints are back pain, feeling tired and fatigued all the time, just want to sleep, urinary frequency, and not being able to sleep as well, having difficulty sleeping. So the bad symptoms of pregnancy, meaning you should go see a doctor right away if you have any of this and you're pregnant. Vaginal bleeding. We never want you to have vaginal bleeding. That's always a bad sign, so you have to get medical care immediately. Very severe nausea and vomiting. If you're not able to tolerate any food or water, you are probably dehydrated and you need some IV fluid, so you have to go see your doctor. Burning when you urinate could be a sign of a urinary tract infection that can put you into preterm labor, or it can cause a miscarriage. Difficulty breathing, always bad in pregnancy. Seek medical care. If you're not getting oxygen, your baby's not getting oxygen. Really bad cramping could be an early sign of a threatened miscarriage. Chest pain. Of course, you shouldn't have chest pain anytime, much less when you're pregnant. So if you have any of these things, you should go see your doctor right away or go to the emergency room or labor and delivery. So a lot of my friends always ask me, what do I do if I have signs of pregnancy? Well, first thing, easiest thing, just go get a pregnancy test. They sell pregnancy tests over the counter at Walmart, Walgreens, CVS, even at the 99-cent store, and they are accurate. So go get a pregnancy test, easiest thing. If you don't have time, if you don't want to go, just go see your doctor. They'll either do a urine pregnancy test or they'll draw blood and check a blood pregnancy test. Also, if you go to the doctor, they might, if you're far along enough, they will just try to listen to the baby's heartbeat with a Doppler, with a little probe that you can listen to the heartbeat, or they'll just do an ultrasound and try to look at the baby. So if you've determined that you are pregnant, go see your doctor. Just go start prenatal care as soon as possible. Start taking prenatal vitamins. You can buy them over the counter. They're all pretty much the same, and they have instructions in the back how to take. Confirm that the baby's in the right location. A lot of times women get pregnant and the pregnancy doesn't implant in the uterus where it should be, and it implants outside, and it can be very, very dangerous, can cause a lot of bleeding. So as soon as you know you're pregnant, had a positive pregnancy test, or you suspect, confirm where the pregnancy is. And the other thing that you have to confirm is that the baby's alive. If there's a heartbeat, either by a Doppler listening to the heartbeat or an ultrasound looking at the baby's heartbeat. If you smoke, quit smoking right away. Smoking can make you lose the pregnancy. It can be very bad for you, so stop smoking right away. All right, you guys, like the video down below, subscribe to the YouTube channel, and like us on Facebook. And if you need a consult, there's a consult link on the homepage of the YouTube channel, and I'll see you next week. Who should freeze their eggs? First of all, you should freeze your eggs as soon as you're considering freezing your eggs, because the longer you wait, the older your eggs will be. And adding age to your eggs makes them a little bit